so it's more like, just quick question and answers. So if anybody has any question regarding nursing transitioning, things like that. And then depending on the crowd, sometimes I probably do NCLEX questions. So yeah. hmm Still trying to figure out, different things. So my microphone, I wanted it on the. You hear me better? Okay. I'm not hearing it through here. Hello? Ah, okay. I'm gonna turn this up and see. Okay. Yeah, so I'm still uh so trying out these earphones, and I have a mic, but I didn't realize that I didn't charge it up today after my live this morning. Hearing me a little bit better? Okay. All right. So I was just of recently, I start doing my exercise routine online. So at 5:30, I come out and just exercise, just ride my bike. Yeah, for the extra motivation. But then I'm trying to be a little bit more consistent throughout the week, like 7 o'clock thereabouts. So yeah, I'm trying. Uh-huh. That's from Grovetown. Yeah, my brother's teacher, kindergarten teacher at the time, years ago, was Miss Shand. Okay, okay. Uh-huh. Yeah. Okay, okay. I haven't been to Grovetown for a long time now. I'm in Texas. Okay, okay, nice. Okay, not a problem, not a problem. Thank you for having me. All right, you too, thanks. All right, no problem. I probably don't know how to disconnect. Um, that's a stage. That's a match. Hold on. Ooh. Who can help us here? There's nobody. Let me see. Okay. Co-hosting. Okay, I saw something regarding co-hosting a while ago. Where did I see that? Okay, I think probably disconnect from live. Okay, you will continue after. All right, so I find it. All right, no problem. Enjoy your day now. All right, bye. All right, so that was nice. That was random, but yeah, she's from Manchester, Jamaica. She's from the south, so. Oh my word, but how are you guys doing? Welcome, welcome on YT here and TT. Thank you so much for tuning in. All right, so let me just share up the live a little bit to have a few persons pop in. You know. Yeah, so I'm gonna try to do 1 hour. Oh, it's 7:13 already. Try to do about an hour, and then we will see how that goes. And remember to go ahead and tap up the live, like up the live. Just exercise this little finger. I'm sure no one want arthritis to be in the finger, right? So definitely go ahead and just do something like this to tap up the live. It kind of gets it shared in a sense to other persons. So definitely, it's not gonna hurt. If your finger start hurting, then definitely stop. But you guys will be fine. Thank you so much. You guys will be fine. All right, and then from there, so we are gonna have our little live session today. It's more like a Q&A or whatever you guys want to talk about. I'm up for it. On Thursday, we will be having our study session. I said today we were gonna do a study session as well. So it depends. It depends on, you know, how many persons pop in and if that's something that we want to do. But I just feel as though the 1 hour is not gonna be enough. I am usually free on a Friday, so it's a little bit easier on Thursday evening. So, you know, I was just saying Thursday evening we can give it the 7 to 11, or depending on what you people want, we can always do probably like 30 minutes of it. And then I'll try to jump off because I still have notes to do and I have to wake up in the morning so I can actually do my cycling class. All right. Hi, Tekelo. Truckins, welcome. Thank you so much for tuning in. How are you doing? Yeah. So definitely we can do that and then from there. But if you have anything that you want me to talk about specifically, you know, go ahead and leave it in the comment and I'll go through and answer them as best as possible. And as usual, if you're new here, follow me on TikTok at ThinkNursing as well as on YouTube at ThinkNursing. The handle is the same thing, one word. Subscribe to the page, follow, and ask a ton of questions and let me answer them. All right. Jadon, welcome. So Jadon is asking, how would I find a recruiting company to work in the States as a nurse? So you have a few companies that does recruiting from Jamaica. So you have MedPro, you also have Avant Healthcare Professionals, you have O'Grady. I did come on the Avant Healthcare Professionals, so that's the one I use. So definitely I would recommend them. Never had any issues with them. I don't know how it is, you know, almost 10 years later. Yeah, I don't know how it is with them, but I never had any issues with them, and I would highly encourage you to work with them. When I spoke with a few persons who have transitioned to the States, a lot of them are saying that based on, you know, person's experience with Avant, the cultural transition in class or that period was very, very good for them. So a lot of persons boast about the cultural transitioning. And I think that's one thing that a lot of nurses definitely will benefit from if you're moving from one country to the other. So yeah, I would highly encourage you to work with them, reach out to them, and then from there, the others are good. My friend came up with one and she had like a terrible experience with that company. So as I say, based on my experience with them, I would highly recommend them. All right. But you can go online and look them up, or definitely they are on TikTok here as well. And I think they have a YouTube. Do they have a YouTube page? I don't think they have a YouTube page. But I know they're on TikTok. You can always go ahead and type it in online and you'll see their name pop up. You can always just go ahead and apply. Yeah. All right. Let me try to send this out a little bit more to trying to figure out all the. Yeah, but you have a few companies that, and you can also think about the direct hire as well. You can think about the direct hire as well. A lot of persons have been talking about that. The process seems, so let's just say, you know, in hand, you'll get a little bit more money than with the recruiting company because, you know, the middleman is there. But in terms of you handling the paperwork, I'm probably confused about what paper to, you know, use for certain application, getting all of those things done. It might just be a little bit of a headache. All right, it would be a little bit more of a headache. They would provide, I think probably they would provide like the funds to get you started with certain things. Don't quote me on that, but based on one nurse's experience, she said it was a bit of a, it wasn't that bad. They help you, but you know, with the recruiting company, you will find yourself having more resources available to get you through each stage. All right, so definitely look into that as well. I know there was one person who was asking about sponsorship. The person was in the States here, was asking a few questions regarding getting a sponsorship, I think for the green card. I'm gonna try and get that person. I think that person was on YT. I wanna try to see her, what's her situation, whether or not we're lean or them way them, I don't know. Because I don't know of how to go about with that if you're already in the US and looking for sponsorship. So I guess we'd have to figure out what your status is, and then from there. But yeah, that one was just a little bit tricky for me to answer. All right, so I'll inbox her, find out what her status is, just to kind of have an idea. But if she's already in the state and looking for sponsorship, yeah. Anyways, was NCLEX hard for you? So honestly, so when I did NCLEX, I was already working as a nurse for how many years? 3 years or 2.5 years. So I had some experience, but the experience, it's not anything you can rely on to go in the NCLEX and, and say, okay, you're going to answer the question based off of your experience. If you have a lot of experience, no, that's not going to be good for you with the NCLEX. In terms of the questions, I would say, I think if I had prepared a little bit more, because at the time, yeah, you're thinking that you're a nurse, you can go and answer the multiple choice questions. So I wasn't really studying that much. I did a lot of questions like pharmacology questions, because I know that was my weak area, pharmacology. So I did a lot of questions, mnemonics, trying to remember the different classes of medication, and then from there try to answer them. But I never really did a lot of U World that you hear people talk about, all of those courses. I never did much of those. The recruitment company, they had different things signed up, but I never really did much of it. So was it really hard? It was a bit challenging, especially the all that apply question. Select all that apply question. But as I say, when I go in the exam, based on what I was reading, they always say, think of the perfect world. So that was what I had in my mind every time I was answering the question. This is a perfect world. There is no short staff. Resources are available. Whatever I need is available. The doctor is available. Things like that. That's how I go about with answering the question. And as I said before in my live, I did the entire question. I did the entire exam. Yes, I did the entire set of question. I never really came out feeling as though I failed the exam, because I say the computer already, if they determined that I wasn't doing well, the exam would have cut off. You understand? And even if I had failed the exam, I wouldn't feel that bad, because when I was coming up, I was like, I'm gonna just try out this thing. You understand? Because at the time there were a lot of persons who were doing their NCLEX and they weren't getting really good scores. So we were just thinking it was a Caribbean thing or something like that. So I wasn't really feeling bad that, oh, I might not do well on it. I just wanted to kind of test out the exam in a sense. So, but I did it and I passed it, and that was it. All right, as I say, I completed the entire course, the entire exam. How much question was it? Yeah, man, I walk out of the exam laughing, just smiling, because I'm like, whoa. But the good thing about, the NCLEX is you get your license, and when you go and apply for a job, nobody's asking you, how many questions did you do? All right. Did you, the exam cut off at 75 questions, 85 questions? I've never heard anyone ask me, what was my score? You don't really know your score, apart from if you fail. All right. And that was it. So, Mam Pokua, hey, I'm back. I took it in Friday and passed. Congratulations. Congratulations on that. Welcome, nurse. Welcome, welcome, welcome. Do you want to share your experience with us yet? All right, so this nurse, Mama, she went and did, yes, your newest nurse. Not a problem. Congratulations. Yeah. Did Did you get a lot of like select all that apply questions? I'm curious. I'm curious as to what the exam was like for you. Thank you for that heart, Ali. Ali, this, all that. I think. Oh, Ali, this, Ali, that. Thank you. System cut off at 85. Wow, you're one of the bright one. Nice, nice. I'm happy for you. Yeah, it's nice. So you had a lot of like delegation questions or clinical questions. Select all that apply. Let me see if I can send you a request. Oh, I see something here. Who is this? Oh, you sending me a request. So then I used to TikTok. Then I used to TikTok. That's the thing. Hi everyone, welcome, welcome, welcome. Thank you so much. And remember to go ahead and tap up your screen. All right. Just work this little finger for today. All right.
Getting ready for it. I was listening to you the other time, and then you did lots of delegation, and I think you did a few of priority questions as well. I have also been using another question bank, but what I realized was that mine exams was like 80% of the priority questions, like prioritization, 80% of them, and it kept getting harder. I got so stressed, and it was just straightforward prioritization. Like they give you a list of about 6 patients, and they're asking, who are you going to, take care of first? Who's, is a priority? And then it continued into a lot of case studies, and all the case studies were also prioritization. My select all that apply were just about, not much, just a little over 5 or 6 questions were just about select all that apply. And then the regular traditional questions where you just pick an answer. But I'll say that 80 to 90% were prioritization questions, and they were so hard. So when the system cut off at 85, I was
Oh my word.
So stressed. I didn't know how to feel because the question bank that I was using had assessed me and said my chances of passing was very, very high because they have low, borderline, high, and very, very high. And mine was very, very high. So I was stressed, but I was still positive because I feel like, and all these type of questions I had practiced on the question bank that I was using. So I kind of used the same thinking process in answering the questions. So I wanted to believe that I'm okay, but at the same time, I was stressed because it was a Friday and I didn't get to see my results
until Monday.
Someone told me you could pay and see it in 48 hours. So I checked it on Sunday morning and I passed. I was so happy.
Nice. Happy for you. I'm happy for you. Congratulations.
Thank you. Thank you. But I want to say thank you too, because I had some delegation questions as well. And I learned some tips from you. And it was mainly CNAs or UAPs do not assess, they do not educate. And I had some questions like that. So like I just remembered what you said and it really, really helped me. So
nice.
Thank you for that too. Yes.
You're welcome. You're welcome. When did you graduate from school?
31st of July.
Okay. And did you do any review course or you were just studying by yourself?
They did the NCLEX, comprehensive NCLEX review for us, and then that was it. But the school gifted all the graduates the question bank that we used. So that is basically what I was using. And anytime that I felt like I was weak in an area, then I just go back to my nursing notes in my ATI books and kind of refresh. That's what I was doing.
Okay, nice. Okay. Yeah. So what was the most challenging part of nursing school for you?
Initially, it was pharmacology. But one of my instructors, she's an Indian. She kind of taught me how she studied, and it helped. I realized that I was just learning signs and symptoms, but I realized that if you learn the patho of how
Exactly.
things happen in the body, then you can kind of work your mind around it and then
Exactly.
know why this is going wrong because of this, and then you can kind of, work it into the medication. Yes.
Yeah.
Yes.
And that's why I always tell people, make sure you're studying broadly, because when you do that and you understand the underlying,
Yes.
condition, the pathophysiology, as you said,
Absolutely.
that will definitely help you, not only for the NCLEX, but,
Yes.
for everything
In life.
else in life itself.
Yes.
All
Yeah.
right. Okay. So you're currently, where are you currently located?
I'm in Indiana.
Okay.
Yeah.
So what area you planning on going in? Do you have a area in mind?
I love peds and OB. That is what I want to do. But I would want to do peds and OB after my maybe BSN or RN. For now, I just want to do long term and get some experience before I branch into peds and OB.
Okay, nice. So how long you planning to stay, in your ear before you do your BSN?
Long term care, just med surge. Yeah.
How long you planning before going back to school? I was asking. Sorry.
Just a year.
Okay. Okay.
Yeah.
Nice. Nice. Okay.
It was so stressful. Oh my gosh.
How long was the exam?
So I think I'm a very slow reader, and because I'm sure by my accent you can tell that I'm not American. I am originally from Ghana.
Okay.
So I had accommodation in school for my exam, and so NCLEX gave me some accommodation. They gave me extra 2 hours, so in total I had 7 hours. But right after the 85th question, it cut off, and I realized that I only did about 2.5 or 3 hours.
Okay.
Yeah.
Okay. Well, that wasn't bad. So did
Bad.
you have any nursing experience prior to doing the program?
No, I was the CNA, and then so whenever I started, it was hard for me, and then I failed. And when I failed, I decided to take a break and then go back. But when I failed, I had passed my pharmacology in nursing by then, so I decided to take the state exam and be a QMA, a qualified medication aid, and work for a while, like kind of chill, relax, and then go back. So that's what I became a QMA for a while, like for a year before I went back to nursing school. Yeah.
Okay.
Yeah.
That's nice. I'm happy for you.
Thank you. I don't know, but whenever I came out and I said it was so hard and I was stressing, someone said, well, it's been said that if it gets very hard, then it means you're doing well.
Yes, that's what I was going to say. Yeah, usually if the questions are easy, probably you're not mastering it. And so what they do is they'll give you another easy question. If it starts becoming hard, then, you're kind of overcoming, the exam itself. So
because it was getting hard along the way and I was getting so stressed.
Oh my word. Okay. Well, I'm happy that you overcome this first one.
Yes, thank you. And I was like, I need to join your live again and tell you that I passed.
Well, we're here, but I want you to come back tomorrow, the next day until, you get your masters.
Yes, absolutely.
TS Music, welcome, Vienna, welcome. Yeah, so definitely. So I don't think I've gone on your page. Are you active on your page?
I'm a little bit active, just here and there, but I've started posting more. I've just been happy, so I've just been posting my NCLEX and nursing journey, basically. That nothing much.
Okay.
I'm now thinking of what to do with my page, but maybe become something like what you're doing, but I haven't thought about it because it needs the whole planning and all that. So yeah.
Well, if you're gonna sit down and wait for the planning, girl, you might not even start for the next 5-10 years. So you are the content, so go ahead and put out your content. There's always gonna be someone out there looking for your kind of your niche.
Thank you so much.
Not a
Thank
problem.
you for your help, and keep doing what you're doing because you're helping some of us.
All right, not a problem. I am here anytime.
All right. Bye-bye.
All right, later.
Thanks for having me.
You're welcome. All right, so I see a few persons popping in. Little Player, Desreen, TS Music, welcome. Good night to you too. Beauty Club Luxury Skin. Trini Chubbs, how are you? Let's see what you're up to. I know the other day you were heading out for work. Let's hear what it is like working in is it Trinidad? Yeah. But Jojo, welcome. Let me hear what Jen is saying here. Jen Bunny. All right. So how are you guys doing though? How has your day been? And as I say, feel free to go ahead and leave any questions and I'll try to answer them in the meantime. All right. I'd seen someone that I said I wanted to talk with, but I think they left. Yeah, but go ahead and definitely join me on this page on Jojo. Thank you for the roses. All right. Jesus is Lord. Good night to you too. How are you doing? Yeah, just join me on the page here. I'm trying to see how I can I want to do more, like probably 2 days for NCLEX questions, and then from there we'll see. I know definitely on Thursday, as I said, Thursday, and I was thinking about Tuesday night, but then I just feel as though Tuesday night is a little bit busy because it's the start of the week in a sense, you know. So, and I probably want to do probably like 2 hours. 2 hours not so bad, but then 7 to 9 I have an appointment at 9 o'clock to do some things, and then yeah, that's just like a lot. But what do you think? What days you want me to go ahead and do the live and give some time? Suggest some things for me, please. How you like the live? Hi Jen, life of a party. I'm doing good. The live is good, you know. I actually enjoy the live. It feels like, you know, my friends are here sitting down chatting, but yeah, we get a lot of information going discussed here on the live, so that's good. Yeah. So how was your day been, Jen? And thank you so much on YT as well for tuning in. All right. You can also follow me on TikTok at ThinkNursing, and the same handle for my YT page, my YouTube page. So go ahead and subscribe to the page and ask any question. Watch the videos. There's like tons of videos over there. So grab your popcorn and go over there and sit down and enjoy the content. And then you can always reach out to me as well. All right. 7:30. All right. So what we can do is, because I thought persons were going to be popping up, we can actually, who wants to do questions? Long and tiring. I'm just laying here watching you as my entertainment for the night. All right, mademoiselle. All right. So what we can do is, do you want me to do some questions? We can probably do some questions because I never had good evening, Unbroken. Unbroken, I always have a question. Let's hear what he wants to talk about. Yeah, let's hear what Unbroken wants to talk about. Go ahead and type your question, boss. Yeah. And then from there, we can actually do some questions. I know the other day someone wanted me to prepare some, I think it was a geriatric question. Finance to nursing. I don't think so, Jen. Ready to learn about nursing? I think you're probably gonna be bored. Yeah, I think you're gonna be bored. Yes, so I said I was gonna do some NCLEX question, geriatric question. Car natural, just I left work. I'm sorry. What time is it now? 7:30. Yeah, I leave early though, man. I would normally be like through the door by 7 o'clock. Whatever time they come, I'm already done. My bag ready, and 8:30. Okay. Yeah, usually 7 o'clock. May I walk through the door, not looking back. When I come over to come cook for you, what time hubby come home? Need to know so I can hide. Why you always this hiding thing? Can't bother with you, Ciao. Anyways, yeah. So what question? What is it that you want us to talk about apart from cooking? All right, so we can actually do nutrition by Andrea. Welcome, Andrea. Welcome. Castu Morris. All right, so we're gonna do a few questions. I'll try to do probably like 25 questions until 8 o'clock, and we'll see how that goes. What you think? Going once, going twice. Sold? Now I'm thinking about transitioning into a new career. What you want to go in? Naresh Kumar, welcome. I said today, nearly bleed out from mitral clip on the access side. Oh, Lord of mercy. I'm sorry, what floor are you on? You're in ICU or surgery? You want to come on my live? You want to come and talk about your day? A day in the life of a nurse? A real day in the life of a nurse? Cardiac step down. Okay. Let me send you an invite. And let's just where that they know. And then you can actually just, rather than you type in, it will save you. Why I can't find you? It will save you the energy of typing. How me send this thing? Oh. Hi, how are you doing?
Manners and blessings. Just coming off the floor and I'm in the car right now.
Hold on. Who is this?
I think this is the first time I'm interacting on your live.
Oh, you saw that? I thought it was Ron, one of my batchmates. Because I know he works in ICU. So you sounded like him. Come here and say a long time and I hear from Rowan. I need to probably call him and see if he's alive and well. Okay, but welcome.
Probably a sign for say call up Rowan.
Yes. So that's true,
You back home?
Huh?
Are you home?
Yeah, I'm home.
No, as in Jamaica, sorry.
Oh, no. I'm in Texas.
Oh, no wonder you're on Central Time. That's why.
Yes.
I'm somewhat right beside you. I'm in Florida.
Okay. Nice. So what's if you don't mind, what's your name? What them call you? Or you don't want to give the party?
They call me Toxic. I'm joking. On here, my handle is Toxic. Whenever I'm speaking seriously, as a matter of fact, should I switch persona? Normally, I jump on TikTok, and it was pretty well. Let me say this first. Normally, I jump on TikTok after work as a means of just blowing off steam, if you get what I mean. You leave work and you're blowing off steam, so you're just seeing all sorts of things. So I have a handle that is normally Toxic because it's just, you just spend all day caring for people, so you just want to come on here and troll. Right? So based on the tone of my voice and everything, have you ever heard of the term carnal? And then you know what oral mean, right? So I literally combine the two words and you get carnaural. Right. So normally I come on here and I'm just messing around, but it's when I saw this, I'm like, oh gosh, it looked like a sign. So let me jump up and talk with some sense and have a proper conversation, right?
Okay, that would be nice. Really, really nice. So welcome, welcome. Stacy, Think
Blessings.
Nursing, and this is my family, my friends. All right. What you said, Jen? All right. So yeah. So were you trained in Jamaica?
No, I was not trained in Jamaica.
Okay.
Actually, I think when I heard you said the Central Time, I thought you were back home. That's why I asked.
Okay. So talk about your day, Tell me about your day. Tell me a little bit about your day. Or tell me a little bit about your background. Let's go for
Well, my background is multidiscipline. I've been into this field now for like 21 years.
Oh.
So literally, I'm one of them who want to come out. I'm just looking for a niche to kind of like come out and then now retire out of that. You get what I'm saying? Let's see. Background. Nursing was never what I wanted to do. I used to build and fix computer, network administrator and things back in the day. This was back in like 96, 97. You know what I mean? Then I went into nursing after 911, right? Graduated in 2003, and then I went in there. So after a while, male nurse into the industry has its own challenge because, once again, male nurse in the industry, right? And I don't know if you got the news flash, but nurses are considered some of the most toxic people in existence. I know, one of those stigmas, but it is what it is.
Yeah.
Right? And overall, I've tried a lot of things. That's one of the niche that I love about nursing is that it's very flexible. If you don't like one practice, you go into another. If you want a melody, you know what they call it? A medley of things, you can stay into like a proper practice, like where I'm at right now. I'm in a step down, which means, I'm not all the way in ICU. I don't want it because I've been there, done that. And I don't want ER. I don't want to have to treat and street. But I like to connect with my patient. It's been one of the things, I'm a talker. You hear my voice, so a lot of people tend to listen to this cadence, you know what I'm saying? So at the end of the day, it's pretty fun. I've always had fun with it. It's something that I've grown and love. Is what I mean? So, time and day, I'm going to give you today now. Today was kind of funny, right? Today was pretty calm. So, I came in. I had 2 open heart patients, post-open heart, right? I had one going for a mitral clip. And then the other one just came in last night for a heart failure workup. So my day went like this. Everything was going smooth pertaining to recovery within parameters and everything, right? And just around 4:35, the 12-hour thing go again now. Around 4:30, 5 o'clock, the one that came in for the heart failure workup all of a sudden developed chest pain, right? They're on Primacord drip. So literally, the doctor that did the right heart cath today was literally coming in to check on this patient after the right heart cath. And right as I was about to put the nitro in his mouth, he goes, "What are you doing?" I said, "He has chest pain. I'm about to drop a nitro under his tongue." And he goes, "No, grab a baseline first." So I had to scrape the darn nitro out of his tongue and take a baseline blood pressure because how we stay up on the floor, like the moment somebody said chest pain, it's a cardiac floor. He has angina. Me walk with my nitro in my pocket. You get to me, I say? So me ready all the time for anybody with chest pain. Anyways, took the baseline and everything. Right? Because he was clutching his chest. So took the baseline and everything. It can't handle. We stopped the Primacord just because we didn't want to bottom him out. Right? And then all of a sudden, we had my patient who just came from the mitral clip. This around 5:30 now,
When the time to close the shift.
The doctor made her rounds late because he was off the floor. Obviously, he had the mitral clip procedure today. Brother, when me tell you, said the doctor called me, God made me answer because normally when my hands are busy, I don't answer the phone, I go back and check. Sir, doctor called me and said, your patient's bandage is bleeding. Cockroach, look on the dark red blood will full up your pressure dressing. Me have to run, me take off my glove, take off down the hallway, right? And take some sterile gauze and push down upon the access site. And I push down for about 5 minutes. Lift up, take off the old dressing, take another pressure dressing, put in place. Just for precaution, I went and grabbed a sandbag and put it on his access site. Alright, cool. One fire out. Come back now, run a stat EKG, run some labs real quick, just to make sure that one alright. Then my post-open heart patient now, I say, him not feel too good. Back foot. Stets round neck, me there do assessment, come to find out a indigestion because he just don't eat.
Okay.
Alright, cool. Mine, you know, one of my patients, them downgrades and I had a new admission.
How many patients are in your care? What's the ratio?
4.
Okay.
4. Today is 4. 4 to 1 typically because we're open heart typically. Typically. Sometimes with then around pretty with 5 up under with skin. So what you do now? Patient come in syncope episode. But sinus tachycardia. I'm like, alright, then the pancardism drip. I say, okay, cool. This sound kind of cool. Lady, demented. I have to do the address 1 month of wound because you know you have to take picture and document and all this hosted and comfort. Guess what? My chest pain patient start up again. So I have to lay him flat in the chair, rise up him foot. And I just saw me just them I'm in a circle in the last 2 hours of my shift. Always come down to the last hour to 2 hours of your shift. And I tell you say, me not too long come in, sit down in the car, and that's how this come round but now. Full circle. Is it? Any questions?
You know, say like I'm picturing because I was working in a cardiac hospital. We never had much post-op because I was working in the emergency room, but it sounded chaotic like when I was working, dealing with the LVAD patients coming in. You only have 2 nurses, no tech.
We're definitely a LVAD floor.
Okay.
I'm LVAD certified at that hospital.
Okay, nice. Yeah, I did the certification.
So, are you still on the floor?
No, dear. I'm not in the hospital anymore. I'm not at bedside.
Say hello for me, so
Lord have mercy. Look here. I need a little bit of soft life. What do you call it? Soft nursing?
So what do you do right now, if you don't mind me asking?
I do house call as a nurse practitioner. Some days I'm bored and I miss nurse bedside, but...
Oh, you're going to get your practitioner.
Yes.
I don't know. I don't know if I want to go for it till this day. Mine, you know. You see, I'm going to be honest with you. Like, I'm one of those who was comfortable. I did ER, I did ICU, I did traveling. I'm all over the place. Are you a FNP?
No, adult gerontology. But I do primary care.
Big up to yourself.
I didn't do acute because then when I realized what they were paying and the responsibility and all of those things, like no,
Right.
So yeah, I want the soft, the soft nursing life that I hear everybody talk about.
Look at, hey, listen, man, listen. I would never envy anybody who went ahead and stepped up to that podium, but in truth, especially in other state, I don't want an FNP, I don't want no nurse practitioner. I'm sorry. Right? I know so much, and them go right back to floor nursing, believe me. That between me and you.
No, even...
And I'm not using their experience as mine. It's just that I don't see any specialty that I feel so static, if that get away. If you get what I mean, you know what I mean? And then if I go to anything acute like ER or ICU, I want bunch another, but me can't bother with that. I'm sorry, not sorry. I'm good after that.
I wanted to do emergency.
So I think I might just come out and start some business type thing and just allow everything alone.
Okay. Okay. That's another thing too. Can always look into that.
Real talk.
Mm-hmm.
But me proud of you, man. Me don't know you, but me proud of you. That's how we stay. As it we have to show the love regardless.
Not a problem. Thank you. Thank you. So, how do you decompress on a day like this? What is your go-to activity when it comes on to
You know, hear
self-care?
me say me come out.
You sit down in
Me
it.
come out and jump on TikTok and balance out with all sort of corruption. But me do
Okay.
me find lives and go and be toxic and you know, you see my name and then they hear my voice and I act like some is a fool and do all sort of ass that and cow fat. It balance, it really balance, man.
Okay. Okay. Yeah, it can be a platform that you can come and, just be yourself. That's what I like about it.
Facts.
Yeah. So, can you sing? You sound like somebody that can sing.
Unfortunately, no. Let me tell you something funny, right? When my voice cracked back home, I was in KC at the time, and they hear my voice and they're like, oh no, you have to come to the cathedral and see and rehearse. I was so shy. I don't like performing in front of people. And I never really took the chance to find out if I can even carry a note. So I just say, no, I cannot sing.
Oh. Okay. But I think you can sing though. It's just that probably you shy away from it, as you say.
Pretty much.
Yeah.
Pretty much.
I know you can.
So, Miss Soft Life, well, what should I say?
It's not no soft life,
nursing life.
It's not no soft nursing life. Not no soft nursing life, because when I come out, I am smelling like cigarette. I'm having, like tons of different things. Dog ears for days, cat ear for days. Things like those.
Right.
So,
I'm going to tell you something funny. I was working for a company doing home health, but it was modified because you're doing all the picks and you're waiting on the antibiotic them and thing. You know what I say? Listen to me, man. You say I'm going to find a day where you have to change the dressing. And then I watch the infusion go on. I'm like, oh gosh, I have to turn up in our house.
I have to stay there for the whole
Sometimes
time.
I just go in my car and sit down. You know what I say? One time, alright, what you do now, though? Me's a certified fat man, So what you do now? One day me go out and chill a house to rot it. Listen to me, Me say me nearly feel like me I drop through the floor to the archive. Me say, why? Every minute me I walk and stop like say me a mime.
It's hard out there, but a lot of people don't know. You understand? A lot of people don't know. Unless people talk about it.
There is a difference on the outside world when you're a male versus a female. In both the outside and the inside nursing is the truth. I saw not really a new nurse, but somewhat of a new nurse. And he's a guy. I'm going to say, yo, brother, I'm going to tell him, I give you one warning and two advice. One warning, don't make them use up your back like say you are a tool. That's a one warning.
We tend to do that a lot. I'm guilty of it.
Oh, you mean enough?
All of us as nurses, female nurses, we're guilty of it.
Oh yeah. Oh yeah. I'm gonna say make sure say you are the most friendliest people because I call myself old school nursing, you know why? Me not really mess, even though I will have a woman patient, but I'm always happier when they're independent. If you see where me I go, you know what I'm saying? But anytime me have them have IV and thing, me can't throw an IV all in the dark. I remember one time hurricane, me have to start IV with one flashlight in my mouth. That's cool, no man.
Look here.
Flex me and flex.
Look here.
Flex me and flex.
What was happening at that time? Just kind of give us an idea.
Hurricane in Florida, but never figured to say a hurricane center this one. And the light did go out. So the generator was kind of shorting out. And that room at the time didn't have any red plug. It was one of those units, only units of our hospital, brother.
Okay. I'm gonna read Safari with that.
IV all over the place. So I told him, don't make them use up your back. Be a nice guy and learn a skill where you know you're pretty good at. For me, IV.
I love IVs.
You know what I say? Mm-hmm. What you say?
I love doing IVs. Yeah. Me the resource
Oh,
for the
yeah, man.
entire hospital
I get
doing
IV all
IVs
over
and
the
everything. Wherever there's a vein, I'll find it.
Trust. You know what I mean? So, yeah, but it have its niche. Like I said, today now, one of the things that I typically do is to just chill in the car, breathe off, because I don't ever go home with anything. I normally don't leave with anything. I've actually conditioned my brain. The moment I walk in,
That's me.
the world is out, and the moment I walk out, the job is left
Right behind.
in the building. You know what I mean? Of course.
And I always say there are one or
You
two
know?
cases that definitely will, I will walk along with home, but it's not up for anything else. It's just because I know that something
Ooh.
was, tricky about that case. That's it.
For the first time in my life, back in 23, I was still traveling. I was in Georgia, and a very young guy, 23 years old, aggressive kidney cancer. In front of my eyes came in. I called the code, right? I called the code. It was a true code blue. And I was so surprised. I will never forget this. If I tell you this, you're going to drop your mouth and say, what? When you call a rapid, how many people come to your rapid? One or many?
Many.
Huh?
Many.
Many. You know how much come to my rapid? One.
Oh, are you code?
What you doing now? You ready for this? When I call the rapid first. The nurse, the ICU nurse come and go. Because, all right, let me give you a little context. Whenever I travel, I big up my chest. One time, let me give this, you're going to laugh. I big up my chest when I first start to travel. And talk about send me an ICU.
ICU nurse,
right?
travel nurse.
Guess what? Then float the crap out of, hey, me feel like a leaf. You're a fat man, then treat me like a leaf. Then float me go a ER. Then float me ICU, then float me a PCU, then put me on med surge. I was just a filler in. And I saw them treat people when you have an eye practice. I saw them treat you. So when time I renew my contract, I said, do me a favor now.
No floating.
Put me in for med surge telly. Because if $6 not worth it, sorry, not sorry. Not worth it in our Bible.
Yeah, because then you have to learn everything about the floor.
Now. When me call a rapid, is one single ICU nurse who have a telephone who can call everybody. You believe that? I was
so you don't get transmitted to everybody, or they don't put it on the, the hospital system?
Basically, him are the one go to him, come in, assess, make sure everything are going, and I say if it is a true rapid, then him take them, strap them up on bed and gone. Like, what is... At the first me see that.
I don't understand.
In my hospital right now, if me ever call a code, crash card, respiratory,
it's a million people run down.
Everybody will show up. You know? So that was such a surprise at the time.
What level hospital was that?
Which one?
The one that you were at with the one person that showed up.
I don't think it was a trauma, it wasn't a trauma. I don't remember.
Okay.
I don't remember a helicopter pod. But I don't think it was a trauma, but it was a pretty big hospital. Not big as anything, but big in name. If you say Georgia, you're supposed to can guess which one is which.
Okay.
You know what I say?
Okay. Well, that not sound bad.
Yeah, and then so you never got travel.
Yeah, man, I was doing traveling. Different places depending on, you might
as a
RN.
practitioner too?
No. I was thinking about that, but
so I got travel as a practitioner. Me here say them are go on with them where,
I don't know yet. There's just so much things out there, and it's a big turn off some days, honestly. So if I find a good company,
how long you been in the biz, if you don't mind me asking?
Since I've been working as a nurse practitioner for almost a year, almost 2 years working as a nurse practitioner. But overall nursing experience, it's probably like 13, 14 years.
Nice. You're going to yourself, man. You're
Yeah,
on
man.
cockroach.
Yes, I've been doing this thing for a little bit, so I wanted something that was, different, not waking up for 7 o'clock or doing 12-hour shifts, things like those. Because I don't want when I am.
Well, I'm glad you didn't pick up the app. I'm glad you didn't pick up the practitioner where you work 70. Hey, them people are crazy with themselves.
No.
7 days on, 7
No,
days off.
I remember I was talking with this nurse practitioner. She was working in ICU and she was telling me how much she was working. She was doing on-call. And the insurance that she was getting, it wasn't even anything good. I mean, I said, this don't make no sense. This doesn't make any
That don't make no
sense.
sense.
Because if you look on the years of experience...
To me, I've always said this. Believe it or not, I've always said, I believe public servants should literally get certain perks. And what do I mean by that? Nothing that is so advantageous. You know what I mean? I believe like policemen, firemen, teachers, nursing, the whole public service sector, right, should have a flex that would encourage people. Because believe it or not, there's still a shortage of nurses.
Exactly. A lot.
And you know why, right?
There is a shortage because...
Think about why. Think about why there's a shortage of nursing.
I think it's more because people are not paying. I think, people are not paying nurses that well, and the hospitals are not hiring enough nurses because, they want to save a bunch of money. So they want to work the small amount.
That is part of it. But the biggest reason is the bedside nursing has become such a revolting area to practice. Everybody come in, they only want to do their 1 year and then shut off, gonna be practitioner.
Yeah.
And did you notice how congested nurse practitioner has become?
Yeah. It is very saturated.
The cosmetic side of things is booming so much.
Exactly. So some people not even want to become nurse practitioner anymore.
All right.
Yeah. So everybody is, becoming independent, which is good, being an entrepreneur and all of those things. It's good. But yeah, all the persons are not going to be staying in that field.
Exactly.
A lot of people not staying in there. All right, to CEO, welcome. Nourish is asking what do. Yeah. So are you working tomorrow?
Oh no, I'm off. Big flex. Off one going to.
Okay.
Oh no, it really is a flex. So you just wake up and you don't have to move. So I'm off one, working two, working Sunday after that, and then I'm out for about a week.
Okay. Are you taking PTO or it's just like how you set up a schedule?
No, this one is a combination.
I think you're breaking in and out. Huh?
You know what I'm saying? I say, when you take 2 days off, you can take a week off depending on where those days fall.
Okay.
So that's what happened.
Okay. Well, that not sound bad at all. That not sound bad.
You know, miss the hustle, man, and the stethoscope around your neck and a run down patient, and you know, miss the excitement.
I miss the excitement of the emergency room, yes. I miss all of that. I miss the codes. I miss, being resource, team lead. I miss everything, the excitement. I don't miss the, the dressing,
Watch there.
I mean, I have a problem with the dressing, but some of the dressings, them, like...
To the corruption.
Yeah, no. Sometimes I'm thinking about it, say I want to probably do 1 day or 2 days. But then I'm like, to wake up at 6 o'clock? Nah, I don't think I want to do that. Yeah, so... I don't know, but I'm keeping my certifications active. In the event that, you know, I feel as though I want to pick up a shift, I can always just go ahead and do it with my with the company that I do my independent contracts with. But yeah, but I miss my IVs, I miss my, you know, my NG tubes, I miss getting my hands, you know, doing all of those procedures. Yeah, I miss all of that. So yeah.
You have a glow about you, man. You need to come off of that glow a little bit. You know what I'm saying?
Huh?
I say you have a glow about you. You need to come off of that glow there one little bit, man. Come down, come back into the trenches with it, man.
Nah, man. Even if we come in the trenches, the glow is still gonna be there. The glow is gonna be there. This is me all the time, eh?
Oh, God. I said, watch luminescence. That's what's up.
Oh, you know her?
No. That's, oh, wow. That's luminous, man. I was speaking about your glow.
Oh, my glow. Okay,
I was
okay.
laughing about the glow because you said that you glow regardless. So I said, watch luminescence.
There are days, you know, there are days when, you know, the face is straight. Yeah. But for majority of the time, I'm pretty much, you know, yeah, I'm a nurse. I just figure more or less that, you know, the happier you are, the better in terms of the patient care. Can you imagine you have a patient and that is sick and you have relatives that are there and they're just feeling so depressed and then seeing your face just straight and just looking miserable and like the entire world is on your head?
Well,
yeah.
Can I be real with you? I want to tell you, one, congratulations. Two, you were truly made for bedside nursing. I don't know why you leave.
I love bedside nursing.
Because no, I was saying that literally because that's what's missing, and that's one of the very niche between man and woman. You see what I'm saying? All right, hold on there. I'm gonna show you a flex. And you're gonna laugh when me show you. Right.
So I'll go for this.
Watch this. You're gonna laugh when me show you, but watch you do it.
All right, let's see.
One sec.
All right, so we have 5 persons on that live who is gonna be looking in. Let's see.
And of this stature is your nurse, right?
Huh?
Yeah, you hear me?
Yeah, I'm hearing you.
Imagine someone like this stature is your nurse. Right? You can imagine how I would look if I'm.
You're breaking up.
Oh, sorry. 1 second. All right. You hear me better now?
Yeah, man.
All right. I was saying, imagine someone of this stature was a nurse, right? It happens all the time. I'm okay with it. I've gotten so used to it is. But you already hear the voice. Then you see someone built like a darn, what do they call it, linebacker. You know what I'm saying? As a nurse. Imagine if me if I walk around saying that I have a bad day. You think that I'm a threat to everybody. You get what I'm saying? So literally, that is my ordeal right there. You get what I'm saying? That is my ordeal. Forever and a day.
Okay.
You get it? So literally now, women can always walk in and say, if the patient is John Doe, they can walk in and go, John Doe, I'm having a bad day, what's up? And John Doe will go with it just fine. You get what I'm saying?
Yeah.
But me can't do that. I can never do that. They would have been like, oh gosh, he's having a bad day, I don't want him around me.
That's true. That's true.
You see what I'm saying?
Yeah.
So it's a flex. That's why I said you were truly made for bedside nursing.
Okay. Well, I did enjoy bedside nursing. I did. But then after a while, you just want something different, you know? Want to try out
True.
something different.
Ain't nothing wrong with that, man. Elevate yourself, nothing wrong with that, man. That's
Yeah.
true.
Nurse Yams, welcome. Welcome, Paul, Faithful Kiki, RN to CEO, Kumar, Luminous. We weren't doing any questions a while ago, Luminous, so you haven't missed much. All right. We'll definitely be doing questions on Thursday, though. All right. And I will definitely send you the link. I'll make sure I look for your name. Yeah. Okay.
Alright. But listen, man. I will always say this. Keep that glow about you, doing very well the things you want to do. I love and respect what you're doing. Right? You actually let me drop my toxic character so I can actually hold a proper conversation about the career that we're in.
Let me see if I can find that thing that says clap hands. Ready?
The world really do need people like us.
Let's step up.
I will truly and truly encourage anybody to come into this field simply because it's a very fulfilling field. Like I said, 21 years in the build, going on into 22. It is a force to be reckoned with. But let's just always remember one thing, right? They're in the hospital, not you.
Yeah.
Please find it within your heart to know that no one wants to be there, but they have to be there. So let's carry them through that experience with the utmost love and respect, because at the end of the day, they are family that you do not know.
Exactly.
So, Jiggy, right? It was a pleasure. I will actually follow you. Do me a favor. I'm going to, as a matter of fact, give me one moment. I'm going to follow you. I'll follow you on my proper account. I'll follow you on a proper account.
And on YT as well. I want you to follow me on YT as well, YouTube as well.
ThinkNursing?
Yeah.
1 second, I'll do that. Give me a second. Let me slow it down here and
Jamaica, blessings. Blessings to you, Jamaica. Welcome. You said for run. Run from what? From nursing?
Nah, she said run from me because this is my troll account. Give me one moment. Let me come back to you. ThinkNursing.
I can't manage. I can't manage. Okay, Beverly Blair, welcome, welcome, welcome. Yeah, but that was a really nice, day in the life. That was a really nice day in the life of a step down nurse. So, step down ICU. So he works in one of those hospitals that deals with cardiac. So I think it's like a cardiac hospital, or the floor is more for cardiac patients. So that was really, really nice. I remember when I was working in this cardiac hospital, it was a very small hospital, 5-bed, 2 nurses, no tech, no operator, 1 doctor. You have to do everything. You are the eyes of the hospital, the ears of the hospital. Plus you are the emergency room nurse, triage nurse, taking care of all of those patients, including, accepting all of the ambulances that feels as though, their patient is having a chest pain or cardiac, issue, emergency. And even when it's not cardiac, sometimes they do still present, and it's just 5 beds. So sometimes you have patients who are walking past, just see the big H sign to say it's a hospital, and they do show up. You still have to see them, even though sometimes they might not have the resources. And a lot of times it can be very, very chaotic. Can be very, very chaotic because you have patients coming in, don't know where to put them. They're LVAD patients. You have the patients with your heart rate through the roof, shortness of breath, active chest pain. You're prepping patient for cath lab, and it's just 2 nurses and 1 doctor. And then other thing about it is that sometimes you're getting patients being transferred to the hospitals and you don't get a call. The doctor's in the floor don't even get an update to say, okay, then there's a patient that is coming to the emergency room, or there's a patient that is going to the ICU, but ICU don't have a bed, so the patient is going to be held in the emergency room, and then you don't have any bed to put that patient in, and you have to be going in and telling patients, oh, we're going to have to move you out of this bed to go in the hallway or in the waiting room, because sometimes you don't have any beds in the hallway in order to accommodate an ICU patient that is intubated. So sometimes it was really, really chaotic. But, you know, you just have to do what you can, write your report, you know, because if you find out the situation is unsafe for your patient as well as for yourself, you have to go ahead and write that report so you can actually protect yourself and your license. You understand? So go ahead and do that. And then from there, it was a lot of times, it was just like too much. It was just too much. And that's the thing, you know, hospitals know that they need staffing, but they're not hiring sometimes just because, you know, they're trying to save as much as they can. And then they make nurses who are, or the floors that are understaffed, seem as though the nurses, one or two nurses, are supposed to be going above and beyond all the time. And then sometimes what happens is that if you go above and beyond during those situations, they feel as though, you know, the two nurses that are there, because you're able to do it at that time, they feel as though it is something that can be done all the time. So don't nobody try and find any additional staffing for you, you understand, or for the floor. Because I see where you can see 15 patients that are critically ill on one shift, and the patients survive. And even if you don't get any break, you know, they don't care about that. They just know that the patients are alive, we're making money, and that's it. You come back the next day, you ask for staffing, they're not giving any, because I'm going to tell you, oh, you did well yesterday. Yesterday, you know, you guys saw 15 patients, 2 nurses. You can do it today. You understand? But then you have your bills, you have all your expenses to think about. It's not like you can pick up your things and say, you know what, I'm going to be leaving this place and try and find another job. You can't just get up and just leave, you know. So that was just it. That was just it. But thank you so much, Black Buddha. Welcome. Knock knock. How are you? Who's there? Musicalness. Welcome, welcome. How are you? Tyson Gabriel. Tyson. Oh, Tyson Gabriel. Welcome as well. Scrub Live. Tattooed CNA. How are you? All right. So Naresh Kumar is what do stent means in cardiac hematology. So stent is like a little, just think of a little tube, something they're gonna put in, like, you know, the arteries there to kind of help with unblocking those arteries. All right. So sometimes it's like a little metal, a little mesh or something like that they insert in like your artery. So depending on where there's a blockage, they'll put it there so they can clear that blockage and allow for proper blood flow. Hydrocele. Writing tomorrow. RN CEO. Writing tomorrow. Right. Yes, I am RN to CEO. I'm writing tomorrow at 5:30, 5:45 thereabout. All right. So definitely you can join me tomorrow morning for the live. All right. Join me tomorrow morning for the live at 5:30 in the morning, so we can actually Black Buddha. Okay. So we can actually hello.
Did you forget about me already?
Oh. Oh, is your other channel this? Your page?
Yes, ma'am.
Okay. You know, so sometimes what happens is that I cannot remember that, you know, the little accept button is there, or, you know, where they send the request. Yeah, I'm still learning about TikTok, so bear with me. I saw the little one, but I never realized.
Okay, cool. But yeah, that was me saying knock knock. So when somebody say knock knock, it means to open the door and let them in.
Oh, But the thing about it is, you know, a lot of people come knock knock on TikTok and YT, you know. So you can't really open it. You have to be very, very careful.
But this is the deal. The one thing about TikTok that is different from your actual home is that you can kick them out with no remorse at any time.
Okay, okay.
Understand? Anywho, I just wanted you to know that I followed the account on this account.
Okay.
Because I would hate for you to have to be in your algorithm to hear this voice carrying on out and body. You're like, oh my gosh. No wonder nurses are toxic, right?
Oh my word. I'm kind of curious to hear your day though, what you talk about, what you vent in over that page though. But you know.
Oh, really?
Yeah, not gonna let it be a
hear, put it this way, the names change, but the voice never do.
okay.
Alright? So anywho, it was a pleasure meeting you. I'll go ahead and follow you on thing there.
Okay, no problem.
On YouTube. I think Beer Necessity on YouTube or Beer Life. I think it's Beer Life.
Okay.
Alright.
Okay. I'll look it up.
Big up yourself.
Alright, thank you so much for taking the time
You're
out.
most welcome.
Alright, no problem. Enjoy your night.
You too.
Alright. Bye. Alright, so what was his page again? But definitely Black Buddha. Alright, so he's a nurse, so you can also follow him as well on his page. And as I say, he's a ICU nurse. He's also travel nurse, a bunch of different things. So he works in one of those step down ICU units. So he was just kind of giving us a little bit about, you know, his day. And if you're joining in late, remember, go ahead and double tap up your screen. All right, let me make that sound again, because I learned about TikTok. Oh, not that one. Not that one. No, that's not the one I wanted. Can do. Yeah, so go ahead and double tap up your screen so the live can actually get sent out to other persons as well. All right, that's all it's doing. So don't be scared, especially the folks on YT. Don't be scared about, liking the video or the live. It's not gonna hurt. All right, nobody's gonna know that you're here. I won't say anything, and YouTube won't say anything either. All right, so remember to go ahead and tap up the live, and I really appreciate you guys taking the time out. All right. It is 8:25. Do we have anybody else who wants to say anything before we go? I know I said I was spending only 1 hour tonight. I'll come back tomorrow. I'm gonna come back tomorrow, but I have to do some notes. I saw 7 patients today. Yeah, so I want to try to do at least 4 out of the 7, and then tomorrow morning I'll get up at 4 o'clock and try to do at least 2 or 3 of them. And then I'll ride at 5:30, 5:45, and then get back into the game again for the day. All right, no problem, mommy. Enjoy your evening, and thank you and congratulations again. All right, and remember to go ahead and follow Mommy Pokua. I don't know if I said that correctly. I'm in Texas. Yeah, so she just did her exam. She's gonna start doing more content regarding, her nursing experience. So definitely you can follow her. It's not gonna hurt. So go ahead and follow her as well. And as usual, if you follow me, I will follow you as long as you have a picture and you have a name. All right, I will definitely follow you. It doesn't hurt to follow persons. And every now and again, I might just go onto one of my followers and just repost and do everything. I try to do at least 5 or 10 of those for the day. And that's it. TikTok is a win-win situation for everybody, or social media, it's a win-win for everybody. So especially on TikTok. So if you're producing content, even if the content is not something that I personally enjoy or it's not my taste, at least there's 1 or 2 persons that is in my following that if I repost it, if I favorite it, if I like it, it might benefit them. So, you help me help you, stuff like that. Yeah. Otis Innocent, welcome. So yeah, so I'm gonna go now, and then from there we'll touch base tomorrow again. All right, until then, I will see you in the next live, and thank you so much again for tuning in. 10K 24. All right, enjoy your evening now. All right. And then enjoy your evening over here, folks. And remember to go ahead and subscribe to my page if you haven't done so as yet. And leave a comment. I will eventually get back to the comments and all of those things. All right. And definitely join me tomorrow morning for the live at 5:30 for my cycling class. All right. So until then, always say, what's under my nose? Oh, under my, see my nose down here? What's under my nose? I'm out. All right. I'm out. All right, then enjoy your evening.